died from COVID-19 since the virus began to spread 3 years ago. And today, state and federal emergency declarations are officially coming to an end. What that really means is that some government programs are going to go away. You're going to have to pay for COVID tests and treatments with insurance or out of pocket, though vaccines will remain free for most people. We want to discuss now with Dr. Pernell. She's a public health physician. Dr. Pernell, thank you so much for being with us, for sharing part of your afternoon with us. Walk us through the real world implications of the end of this public health emergency.
Good afternoon, Boris. So this really is a mixed bag. It is good that we are finally at a point in the pandemic where we're not at peak crisis mode, right? That should be celebrated. But where I do have cause for concern is that data reporting or compulsory requirements around reporting data specific to COVID will change. We will no longer have a daily tracker that allows us to know what the caseload is. That information will be given more so on a monthly basis. Testing will not be mandated by insurance to be free for certain persons under certain governmental insurance programs or even private insurance programs. I'm really concerned for those who are uninsured. While government supplies last, we will have access to free prevention, so vaccine, treatment, and testing. But when those supplies are exhausted, those who are uninsured will unfortunately have to fare on their own. So good that we're out of crisis mode, but not so good for everyone.
Yeah, certainly cause for concern that you outlined there, especially among susceptible populations. So what would you say to folks that have those concerns about COVID, or those that are simply more at risk, perhaps because they're older or they're immunocompromised?
Don't let your guard down. There is never a time that we should not be vigilant. Look, we need to practice group accountability. We need to think about what's in the best interest of the collective, right? That's what health equity and health justice require of us. So if you have a family member who is older, if you have a family member who has chronic health conditions, even if you have a family member who is uninsured, ensure that everyone gets boosted with the latest bivalent booster. In addition to that, if you're in a high-risk scenario, ensure that you have access to masking. Ensure that you know what's in your purview to keep yourself in the healthiest and the safest point.
Doctor, I also want to share with you something from CNN's own Dr. Sanjay Gupta. He writes about one of the greatest lessons we got from the pandemic. Quote, "While we had tremendous resources to combat this pandemic, our collective poor health put us at a tremendous disadvantage." As you reflect on everything that we've endured as a nation and as a globe, what are some of the lessons you're taking from the COVID-19 pandemic?
Wow, Boris, racism kills. It's just not our collective poor health, but it's the inequalities in the United States of America that led to a disproportionate impact on Black and Brown communities. I lost my father on April 13th, 2020. I lost two cousins. The hospital that I worked at, I saw our beds filled with Black and Brown patients. My sister is a long COVID survivor. That is not normal. And while we were able to shine a light on these distressing disparities, I don't know that we have a firm enough understanding of what needs to happen for health equity and health justice to be at the center of all of our public health actions. And finally, what are we doing to cultivate connectedness across communities and across groups? That's information sharing. That's being able to elevate people's concerns and to connect them to the resources they need in order to be healthy and safe.
Some very important points there. Dr. Pernell, our thoughts are with you and your family and all the other folks that have lost loved ones during this pandemic. Hopefully something will come of the difficult lessons we've had to learn. Thank you so much, Doctor.
Thank you.